I thought this morning's presentation was wonderful. And from my personal just reaction to what you were saying, the emotions were at the surface. Like I almost felt this almost emotion that's hard to describe. But tell us a little bit about your experience with medical volunteerism and international medical volunteerism. What got you into it in the first place, and a little bit about what you described this morning.
Boy, I'm trying to think of how we first got involved in this. Do you remember, hon?
Probably Mongolia, started in Mongolia.
Well, we actually did Myanmar and China.
Yeah,
and
that's right.
Yeah.
Before
I
that,
think I heard about health volunteers overseas from, it was called Orthopedics Overseas then when I was a resident.
Uh-huh.
And one of our faculty members was really excited about it and told me, you should go do this sometime. And so he planted the seed for me. It didn't bear any fruit until probably 10 years later when I was in practice and kind of felt a little more established.
And I we didn't mention it, but you were in practice doing total joints in Southern California for many years.
Yeah.
At what point in your career did you have your first experience with medical volunteerism?
I probably was into it 7 or 8 years, I would guess.
Oh, okay.
Yeah.
So it wasn't so much something that happened way late in your career,
No.
but along the way.
Yeah, we did trips along the way. We went to China a couple of times,
Uh-huh.
Myanmar, Indonesia. Yeah.
That's great. So tell us what you've learned in doing this. You mentioned it in the conference this morning.
Well, I think the most important thing I've learned is how incredibly fortunate I was to be born where I was born and in the circumstances I was born in. I've just kind of taken that for granted my whole life until I was sat down in the world that most people know and see how they live and the kind of resources they have. That's been really eye-opening to me. My wife tells me that I never really recovered from that. I don't think I have. I don't think I've ever recovered.
And Kim, you actually went on some of these trips. Do you have a medical background yourself?
I don't.
So how are you so brave?
I guess because I've traveled myself a lot and was born in Indonesia and experienced these different things, and I knew I could do it. And it was an adventure for him, and I just.
What she's not telling you is that she worked for decades to get out of the circumstances that I showed you today, and I've been trying to get back into them. So
interesting.
Yeah, we're just kind of crossing paths here.
Yeah.
So for her, it's not a great adventure. For me, it's a great adventure.
What a neat thing, though, that you could go together on some of these, or at least many of these trips.
Right.
Yeah. What would your advice be to somebody that's considering getting involved in a volunteer project overseas, and what they should be thinking about?
Well, I think a partner organization is key, especially for your first few trips, until you establish some relationships with people. So I would be looking at an organization like Health Volunteers Overseas, which is the first organization we got involved with. And then I think it was just the two of us went on those initial trips, and then we branched out. Haiti became a great opportunity to take a whole team. I'm not sure where you would do that. Well, I do know where you could do that if you wanted to, because of the connections that I have in other places in the world, where you could take a team. Probably if you created those circumstances.
What did your trips do for your team at home? You work here, and then you go internationally, and then you come back. What did it do to enhance your team?
Well, it binds you together in a way that a few other things can. I think was the main thing it did. A lot of binding activity. I remember we had a party after our first trip to Haiti when I took the big group with us. First time I took our big group with us. We came back and we had a party, and one of the anesthesiologists went with us, gave us all electric fly swatters, because we needed that in the operating room in Haiti. I'd never seen one before, but it's like a tennis racket. It has electrode on it, and you just swat the flies away with it. Zaps them when it hits it. So, it's just, I always have a special place for these people that went with me on that trip.
I bet. What a neat thing. And then you mentioned some of the impact it had on your family. Tell us a little bit about that.
Well, I took my daughter on a trip with the surgical team one time, and We had general surgeons with us, infectious disease doctors, anesthesiologists, emergency room physicians. So she got to see a lot of different specialties kind of in action there in Haiti. And in Haiti, of course, you can go in the operating room and do the things that you couldn't do here in the US without training. And so she got to see a lot of things, and she watched the general surgeon, and that planted the seed, I think, there. I'm not advocating that she should have become a general surgeon. I tried to discourage her from that, but I could not talk her out of it. In medical school, I said, "Don't do this. You're gonna. It's not a good life."
We love our general surgeons, but
we do.
They work very hard.
Yeah, and they work awful hours too.
Yeah. Another thing that you said that I really liked is how this could be something good for burnout with physicians. Tell us about that.
Well, it's just transformative to get it. It's a total reframing of the challenges you have here when you go to a place like that and see the kind of challenges that they have. And you kind of do it in a setting of not having to worry about documentation so much or coding or running a business. You're just there trying to focus on the thing that really matters most to you, and that's helping.
Yeah, I love that.
So it really is great from that standpoint.
I love that. Well, thank you so much for presenting. That was a special treat for all of us. It's so good to have you here, Kim, and your smile and just presence. We have thought about as our organization about getting involved, and I think this was a good thing for us because we've thought about it, but it almost feels like there's no time, or it's too logistically challenging, or maybe we just aren't ready. And I think having that perspective that you gave us helps us to recognize we should move forward.
I think you have the beginnings of a perfect team just based on what I see in conference.
And I think it would be a really good thing for us to do.
Yeah.
We operated on a woman who runs an organization with her husband, who's BYU professor in Africa, and we've talked about it. And so I think after this, we'll sit down and talk about it more seriously.
Great.
So appreciate you coming and speaking.